Good morning, everybody. Thank you so much for joining us today. It's day 2 of our full day training, and today we have ABC for IEP with us. We have Dr. Eleanor Watson and Miss Eleonora Madri. I will let Eleonora introduce herself and a little bit about what we'll be going over today, the agenda and everything, and take it away.
Yes, hi everyone, welcome. My name is Eleonora Madri. I'm a board certified behavior analyst, and I've been in the field for a little bit less than 15 years, helping families and their children with a variety of developmental disabilities. And I am really excited to be sharing with you some of the tools that applied behavior analysis have in managing maladaptive behaviors, and also sharing some tools for self-care and self-love. All right, so hopefully you've received a workbook that we send out via email. That is a way for you to be able to have some resource references for the materials that we'll be covering today, but also a way to stay engaged. And so writing some notes, circle some maybe questions that you might have, and we're gonna have some breaks and a Q&A question at the end for you as well. This is the agenda for today. We have 4 different sessions. The first one talking about self-care and self-love. Then we'll have about a 15-minute break. Our second session would be covering the ABC of behavior. Then we'll have lunch from 12 to 12:30. And then we'll go into session 3, covering reinforcement and punishment. And then session 4 on the topic of what are the functions of behavior. And then we'll have our Q&A at the end. This is one of my favorite topics, self-care and self-love. And the reason why I want to make sure that we cover it, you know, at the very beginning of the presentation is because I found being a parent and being a professional, helping, you know, families and individuals with developmental disabilities, is that we cannot really be at our best if we don't have our own love tank filled up. And what I mean by that is to make sure that we are doing okay, that we have taken time for ourselves a little bit, so then we can be at our best for others. And so what I would like to do is to start from a little quick check-in with you all and just see, where are you now? How are you coming in today's training? This year has been pretty tough for most of us. And so if you have your workbook, you can just circle one of the feelings or a couple of the feelings that you're experiencing today, and then we'll come back to it. But this will be kind of our reference point as to where we are now. And so either you're feeling good, you're happy, you're excited about today's training, go ahead and circle that. If you're tired and scared and feeling helpless, do that as well. And if unfortunately you are feeling angry or overwhelmed or anxious, let's just take a quick moment to do that. I love this message when we board a plane about wearing an oxygen mask. And it says, should the cabin lose pressure, oxygen mask will drop from the overhead area. Please place the mask over your own mouth and nose before assisting others. And that's just a good example, a good visual that I have in my mind as far as, you know, what I was referencing before, that we can only really give our best support to others once we have really supported ourselves first. And so the question here is, well, how do I know if I need an oxygen mask, if I need to take some time for myself? And so I work with children and families, and in the field of applied behavior analysis, we know how visuals and checklists are so helpful to prompt us and just say, wait a second, where are you, right? And so this is a good little tool to really determine where are we at. Are we feeling a level 1? Are we calm and content and happy? Or are we really more into 4 and 5, right? And so it's a really quick check of how are you feeling emotionally? How is your also physical state at that particular moment? And that is really a good guide to then tell us, okay, well, I am at stage 4 and 5. Well, now I need to get back to that one or two level, returning to what we call that baseline level, which is that a place of emotional balance where we feel present, we feel connected, we feel in control of our emotions, we have like a clear vision of our situation, and so that we can also act objectively in moments of crisis or where we need to really support others. This also answers the question, well, how do we fill our love bucket, right? How do we go from here? And so I want to share with you just some nuggets of knowledge, and probably most of you have already know what these are, but just as a good refresher in terms of what are thoughts, what are feeling and emotion, and what is anxiety. So thoughts are really those representation of something, those ideas, those images that arise from the brain, right? And so they're representing really the things that, how we perceive our environment, and feelings and emotion derive, right, from these thoughts and really affect all our senses, our psychological state of being, and then our behaviors and body function. And there is a lot of research now for over quite a while that really has taken a good look at analyzing the relationship between breathing, and for those of you that maybe have or practice mindfulness, meditation, and yoga, so the relationship between breath and emotion. And if we think about it, when we're angry, when we're anxious, our breathing pattern changes, right? And when we're happy, we tend to take deeper inhales. And then anxiety. And so this very real body natural process response to stress. And we feel fear, lack of control of the situation, and leads us to discuss just a little bit what is this fight or flight response. And again, something very real, very normal. It's a survival response that we react to when we perceive threats, and it produces an immediate reaction, a chemical response in our bloodstream, and it affects oxygen in our brain, it reduces it and impairs the thinking, impedes self-control. And so can we imagine if we are at this state of fight or flight response already, how can we manage or support our families, our kids, just any relationship with others, or handling crisis in that state? And another nugget that I wanted to share with you, it's in regard to self-talk. And that's just that inner monologue, that running voice that we have in our head, and sometimes we have it throughout our day, right? And it's the combination of conscious and unconscious thoughts and beliefs and bias. Some things are true, and some things that we repeat in our head are not very, very true. And so this is just a way of, in simple terms, without getting too technical, of how the brain interprets and process daily experiences. And so our self-talk can be very positive. It can really help us through difficult moments, right? We could say that, wow, I'm feeling good. I am good at what I do. I always act from a place of love. But then I can also engage in negative and self-defeating self-talk, which can be quite impactful in our life, right? Where I'm not good enough, I don't look good, I'm not skinny enough, right? And so most of the time, what happens is that we act from an automatic pilot. We are not aware of this inner self-talk. And over time, we just get caught up in these habits of thinking that are not really serving us. And so the research shows us that focusing and being aware, so we also call this mindfulness, on the positive self-talk. So again, the thought that you keep thinking, right, can change negative and self-defeating beliefs. What I wanted to guide you today is through some little practice exercises. So this is all good knowledge, good little things that we're learning today, but if unfortunately we don't put it into practice and we're not consistent in doing it, we don't see, right, the benefit and the effect of it. And so while it's important to do these exercises when we are at those level 4 or 5 to bring us back to baseline, what the research shows us is that if we actually take a few minutes a day to practice these techniques throughout our daily lives, we can actually become expert. And in those moments of anxiety, we can come to baseline much quicker. So that is my goal today, to share some quick exercises that you can do and embed in your routine that will not take you 3 or 4 or 5 hours. The first simple exercise, it's change your thoughts and change your emotion. And so what I would like you to do is to fully be engaged in this exercise and look at this picture and really take a moment, look at it, kind of see some of the beautiful fishes, maybe some of the temperature that you would feel if you would be in this water, and then close your eyes and in your mind for 20 seconds, just kind of engage yourself in this feeling, and then maybe write or think about 5 things related to this and some emotion that might arise. So we'll go ahead and take a quick moment for this. And as you're coming back and opening your eyes, and again, hopefully you were able to practice this with us, some emotions and feelings that you might be experiencing right now are more positive, more calm, because you have focused on these pretty fishes and how nice would be to be swimming with them, right? Maybe the feeling of vacation comes to mind to me this time. So this really highlights that we can change our thoughts and focus our attention, and then in consequence, we are able to change our emotion. Now, the next 2 exercises that I'm going to guide you through are breathing exercises. And again, like I was sharing before, just the connection between breathing and emotions. And so this first one, and it might look a little weird, so just bear with me, is called the alternate nostril breathing. If you are familiar with yoga or pranayama exercises, you probably have encountered this breathing exercise. And again, we're just going to do it for a couple of times. And we are going to take our right hand and we're going to practice just as in the picture. So we're going to stick the thumb and it's going to be placed on the right nostril. And then the little and ring fingers is going to be used to close the left nostril. So what we're going to do is close the right nostril with our thumb and inhale through the left nostril. So let's take a big inhale. We're going to close and hold both, and then we're going to exhale through the right. And now this time we're going to inhale from the right, close and hold, and exhale through the left. And repeat. We're going to do it 2 more times. Ready? Inhale from the left, close and hold, exhale through the right, and then inhale from the right, close and hold, and exhale through the left. It might take a little practice to get the sequence going, but you now understand a little bit of this breathing exercise. Again, a quick little technique that you can do 2-3 minutes before maybe going back to sleep or in between Zoom calls, and just kind of notice how your emotion, your thoughts are a little bit more calm. This one is called Bhastrika. Again, they look a little weird, so don't be, no judgment. Don't be too self-conscious. These are quick exercises that you can do. So for this one, I'm going to just model it for you. We're going to just sit comfortably. We're going to close our eyes and we're going to place and hold our fist here next to our shoulders. And we're going to inhale and exhale only through our nose. And when I inhale, I'm going to inhale and also stretch my arms up over my head with the open palms all the way up, facing forward. And then when I exhale, I'm going to forcefully exhale from my nose and bring the hands back, my fist back to my shoulders. Okay, and we can repeat that, we'll say 5 times so we can get a good benefit. So please join me in this little exercise. We're going to sit comfortably, close our eyes. We're going to put our fist to our chest. And here we go. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Last one. Inhale, exhale. And take a moment, keep your eyes closed. And this is my question again. I wanna see, how are you feeling now as compared to maybe when we started? And so now that we've learned some techniques, they're only going to be helpful for us if we take action and actually do them, right? We talked about and review why self-care is important to support others. And we also want to make sure that when we are taking action and maybe engaging in a new habit, right, in a new behavior, we want to have an accountability partner, right? Somebody that can just say, hey, did you do your breathing today? Hey, what is one self-care thing that you did for yourself this week? And of course, setting achievable goals. So maybe 2 hours of meditation each day might not be practical for most of us, but maybe selecting one of these breathing exercises is. And then definitely consistency, like with everything else, we gotta practice and then celebrate your successes and notice how this little time that you're taking for yourself are making an impact in your well-being, and also how you're interacting with others. And so in summary, what we reviewed in this first session is that we need our oxygen mask before helping others. At any moment, though, we can stop and notice how we're feeling, give ourselves some grace and love in that process. And most importantly, that we have learned that by changing our thoughts, and so by paying attention and focusing and being more aware, then we can really change those emotions and come from a place of anxiety and despair to slowly a place of more baseline of control. And so how do we do that? We're going to pick one self-care exercise that works for us. We're going to set up maybe in our phone some recurring self-check, and then we got to take consistent action and breathe. And so this finishes up our little first session. We're going to take a 15-minute break, but if you guys have any questions, please feel free to type it into chat. All right, and we are back from our break. Hopefully that was a nice little stretch, and we're going to jump right into our next session. We're going to cover the ABC of behavior. If you have received our workbook, we are completing page 5. I love this this quote, and I wanted to present it and share it with you all. It says, if a child doesn't know how to read, we teach. If a child doesn't know how to swim, we teach. If a child doesn't know how to multiply, we teach. If a child doesn't know how to brush teeth, we teach. If a child doesn't know how to behave, we teach, we punish. And so why can't we finish the last sentence as automatically as we do to others? And so this is going to be our focus for the rest of the presentation and training today. And I really wanted to focus some time on really what these maladaptive behaviors are. What are some of the real foundation of what's happening really under the iceberg, right? It's about what we don't see. And so even if in the surface, right, we might have an individual, the child, maybe with a disability that is exhibiting what we call non-compliance, not following instruction, disruption behavior, tantruming, falling on the floor, screaming, aggression towards self, aggression toward others, maybe name-calling, threats. It's really what's under here that we need to take a look at, right? Why is Johnny acting or engaging in this behavior that is, manifesting in that way? And so there's a reference of some of the things that might be going on, right? What we call also those lagging skills, right? There might be some academic or cognitive deficit, maybe it's some unmet sensory needs, some social communication challenges, some attention difficulties, dyslexia, limited frustration tolerance, low self-management skills, difficulties in executive functioning skills. And those are lagging skills that take time and take assessments to really be able to determine what they are. But I want to make sure that we keep this in mind throughout the presentation, that when we talk about modifying problem behavior, we are really talking about let's assess those lagging skills, because the maladaptive behaviors, it's really a compensating and it's a communication of really what's happening. So I want to give you a brief introduction of just the field of applied behavior analysis and a brief definition of what applied behavior analysis is, because the strategies and the principles that we'll be discussing today are based on this science. And so ABA, for those of you who don't know what it is the scientific study of behavior in applied setting. Now, what that means is in real life situations. And so it's interested in the behavior of humans and animals and how learning occurs. And the goal is to improve social behaviors and quality of life. And a great portion of why we know ABA is successful and effective, especially for the treatment and support of individuals with autism, is because it uses data collection and data analysis to understand, explain, and predict why behavior happens and the interaction between behavior and its environment. And so when we talk about behavior, it's not all the time that we talk about maladaptive behavior. Behavior from the dictionary definition is really the way that in which one acts, right? And it's learned, occurs for a reason. And again, applied behavior analysis, the focus of today is really keeping in mind that we want to decrease those behaviors that are occurring too frequently, right? So we're looking at maybe yelling, tantruming, hitting, throwing, maybe repetitive behavior, but we want to decrease it because they're impeding learning, because they're impeding the individual to access the community, they are impacting social relationships, they are impacting the safety and independence of the individual. And we want to, as a treatment package, right, as at the same time as we're decreasing, is we need to increase those behaviors that are not occurring enough, right? Maybe attending skills, communication skills, playing appropriately, self-help skills, executive functioning skills. So they go hand in hand. And so again, going back to why we modify problem behavior, and I put that term in quote because I want to make sure that we really take in consideration the teaching of the lagging skill at the same time. But problem behavior is, we said earlier, a type of communication, a type of expression. We want to modify the problem behavior that is affecting learning, social relationship, or safety. We are not to change the individual characteristics that are part of a diagnosis. And what I mean by that, and something that I encounter often in helping families, is especially for individuals with autism, is that some of these diagnoses, like autism, part of the characteristic of expression of the diagnosis is the engagement in repetitive, stereotypical patterns of behavior. And that's some fancy word to really say that there are some mannerism, that it could be hand flapping, it could be rocking, it could be engaging in loud vocalizations. And while engaging in this behavior might impact learning, right? If Johnny is doing that all day long and he cannot redirect focus attention, then I definitely need to take a look at it and see how I can decrease it at a more appropriate level. It is also an expression and part of who that individual is. The goal, again, of modifying problem behavior is to reduce possible dangers of threats, risk factor that are impacting learning. We want to improve the individual and the family quality of life. And at the same time, and I'm going to repeat it over and over, we want to increase and teach these appropriate behaviors. So those core skills that are missing and those lagging skills. So let's talk about antecedent, behavior, and consequence. And this is really the main first step of really how in applied behavior analysis we analyze behavior and what's happening. The ABCs of behavior: A stands for antecedent, B for behavior, and C for consequence. We're going to start from the behavior, that's that observable response, observable action. And again, it could be appropriate or inappropriate. So screaming, it's a behavior, doing homework is a behavior, putting a seatbelt on, cooking, those are all examples of behaviors. And there's something before that behavior, what we call the antecedent, that precedes the behavior, that triggers the behavior. And that could be an external event or internal event or a combination of the two. By external, I am talking about any setting event. So it could be like an actual location, the home versus the community versus the car versus the school. A specific instruction, it could be the presence of the toys, sound, light, and environmental stimuli, but it could also be people in the environment, and also not only their present, but their own behavior as well. And I highlighted it here because it takes us back to what exactly we talked about in our first session, right? About our own behavior of how are we feeling in that moment, and our state of being, it really affects and might trigger behavior. So it relates to that importance of taking care of ourselves and make sure that we are in that baseline state. By internal, I'm talking about physical, medical, psychological needs. And so we're looking at, is the child hungry? Any lack of sleep? Is experiencing pain, anxiety, stress? And then we have the consequence. And so we have what triggers the behavior, right? The antecedent, the behavior happens, and the consequence is what happens after the behavior, what follows it. And what's important about looking at what happens after the behavior, it because determines if that behavior is going to happen again in the future, right? It's going to increase, or it's going to stop, it's going to decrease. And that's important when we're talking about addressing and modifying maladaptive behaviors. And so here are some examples that we can review to better understand this concept. And so if my behavior is hitting the alarm clock, what happened right before it? Well, the alarm clock sounded, I hit the alarm clock, and what was the consequence? Why do I keep hitting the alarm clock when it sounds? Because the alarm clock turns off. We might have the antecedent, a parent saying, clean up blocks, and the child's behavior is screaming no, refusing to clean up the blocks. And what happens after? The parents cleans up the blocks. So again, behavior, it can be appropriate, it can be inappropriate. Third example, the parent asks the child to take out the trash. The behavior is that the child takes out the trash. And what's the consequence? The child gets to watch the favorite TV show. I'm gonna guide you soon some additional examples and scenario. If you have your little workbook, these are good for you to fill in so you can reference back at a later time. So if my antecedent is an instruction, it looks like time to do coloring, and my consequence is the teacher saying good job, what could be the behavior? So the behavior would be probably the child sat down on the chair, maybe started coloring, right? Second example, the phone rings, that's our antecedent, triggers the behavior of answering the phone. What's the consequence? Typically, there's somebody there on the other line that we want to talk to. Sometimes it's a telemarketer, so maybe we won't pick up the phone as fast when we see that specific phone number. Third example, the antecedent is the loud vacuum cleaner sound, and we know the consequence is that the noise decreases. So what could be the behavior? It could be an appropriate behavior of turning off the vacuum cleaner sound, or maybe asking mom, can you please turn it off? It could also be maybe Johnny starting to cover his ears and start screaming around. I'm going to guide you through a couple of scenarios. We're going to identify in these, we're going to break it down into the antecedent, behavior, and consequence, the ABCs. So scenario number 1, it's time for bed and mom asks Johnny to brush his teeth. She gives him the toothbrush. Johnny throws the toothbrush on the floor and runs to his room. Mom screams, "Johnny, come over here." Mom is exhausted, and after screaming for 5 minutes, she goes to Johnny's room and kisses him goodnight. And so what is that behavior, right? That observable action and response? Well, that's Johnny throwing the toothbrush and running to his room. What happened right before the behavior, that antecedent that precedes the behavior, is that request to brush teeth. And what happens right after? What follows the behavior is that mom screams for 5 minutes and kisses him goodnight. And Johnny is not brushing his teeth at that point. Very good. Scenario number 2, again, we're gonna break it down into our ABCs. This is just our fundamental analysis to then look at how we're gonna modify behavior. So when Johnny needs to urinate, he wets his pants and diaper. And when he wets his pants and diaper, his mom changes him in new clothes and puts a diaper on. So again, we're looking at what is the behavior. That observable action is Johnny wetting his pants and diaper. What precedes the behavior, that antecedent, why was Johnny engaging in that behavior? He needed to urinate. And what happened after the behavior? That consequence, mom changed the pants and cleaned up the wet floor. To consider, again, in these analysis, and specifically when we're looking at the antecedents, that parents, teachers, and their behavior are part of the environment. And so really looking again, and like I was saying before, how those internal behaviors can affect the behavior of others. And a question that will lead us to our next slide is why Johnny picks up the toys when his teacher asks him, but he does not when his mother asks him. And this goes into talking about rapport building and instructional control, right? We need to look at how are the interactions that we're having with our children and learners. If we develop a relationship of empathy and respect and trust, do they feel safe when we are around them, and open communication? Or our interaction out of fear, right? Sometimes when I work with family, I see, well, Johnny will do when dad is home, he will listen. And so my question is, well, is it because he has a great relationship with dad, or is it out of fear, right? And those are the indicators also of making sure that when we have that rapport building and good relationship, we know that learning happens organically and is going to lead to more skill being learned by the child. And so how can we also communicate, right, that this relationship of empathy and respect and safetyness? Well, it's really with our whole being, right? And that includes our body posture, our facial expression. Are we smiling? Are we nodding? Are we engaging? Are we providing eye contact? Are we providing some physical content, especially with our children, to connect with them, some high fives, some squeezes? How is the tone and volume of our voice? Is it encouraging? And this is definitely one of the things that I would love for you to take out of this training is rapport building and developing this trust with the families and the individuals, especially with disability that we work with, because it leads to then an effective parent and child relationship, teacher-student relationship, and then a positive impact, right? So I would like to take you into a little activity now. If technology works and everything, we're gonna watch a little video. And again, if you have your workbook, you are probably going to use page 9. And it's just a replica of this chart. Let's analyze this together. As you watch the video, identify what's the antecedent, what's the behavior, and what's the consequence.
Austin. Already starting to get up.
So we have this sweet kid that is just like crying, right? And throwing himself on the floor. What is the antecedent? We don't know if there was a specific instruction or something that mom said, but definitely maybe he wanted some attention from mom, it looks like, right? And what is the consequence? Well, it looks like the parents are ignoring the child, walking away. And I think at some point, even the dog is walking away, right? In summary, we talked about why is behavior happening or sometimes not happening, in terms of talking about the lagging skills, they're maybe not happening enough. We talked about how behavior is influenced by the environment. And so visually, I love this little diagram because it reminds me that, again, behavior, it's influenced by what happens before, the antecedent, and what happens after that consequence. And so the principle of behavior analysis tells us that if we change the environment, so if we change what happens before those antecedent and we change what happens after, then we are able to change the behavior. Consequences, we're going to explore them a little bit later, are going to be in charge of determining if that behavior is going to happen again or not in the future. And we talked about why we want to modify problem behavior and addressing the lagging skills. We're gonna talk about now about reinforcement and punishment. We talk about the antecedent behavior and consequence, and how the antecedent and consequence are important in maintaining behavior, and that we need to look at them if we need to modify that behavior. Specifically now, when we're talking about reinforcement and punishment, we are looking at the C, the consequence. So this is probably one of the most confusing topics. There's a lot of confusion about reinforcement and punishment, and I hope that with these visuals and some example, we can clarify what they are, and because their importance in maintaining behavior, it's quite relevant, especially if we're looking at variables that might continue a behavior that is maladaptive, right? And if we want to maybe select a behavior to increase or to teach. Reinforcement increases behavior and punishment decreases a behavior. So reinforcement, there's two types of the reinforcement. There's the positive reinforcement and negative reinforcement. And the easiest way to look at this is as math, right? Positive, I'm adding something, negative, I'm taking away. So when I'm talking about positive reinforcement, I'm talking about adding, giving access to something that the individual likes or want to do. And it results in the behavior happening again in the future. So for example, I'm giving Johnny ice cream for getting good grades in his report card. Negative reinforcement is not the same thing as punishment. Although both have some negative connotation, it's not the same thing, because reinforcement increases the future frequency of the behavior and punishment decreases it. Punishment, again, we have two types of them, the same thing, positive punishment and negative punishment. Positive punishment, I'm simply adding something that the individual doesn't like or does not want to do, and that behavior as a result decreases in the future. And so, for example, getting a traffic ticket. That would be an example of positive punishment. We are given something that we don't like, and eventually is going to decrease, at least immediately, for the next couple of weeks, our behavior of speeding. When we're talking about negative punishment, after the behavior occurs, in this time, we're actually taking away something that the individual wants. And this results in the behavior not occurring again in the future. For example, I'm taking the iPad away. So we're going to focus a few minutes on reinforcement to really dissect it and get through some example, and then we're going to do the same thing for punishment. So let's first start with reinforcement. Again, talking about increasing the behavior. So I'm adding something wanted, right? Positive reinforcement. And that could be I'm giving an item, an activity. Maybe there is a person or a friend that is coming to visit. I am giving attention, social praise. I'm achieving a wanted outcome. Those are all examples of positive reinforcement. Negative reinforcement, I am taking away something that I don't want to do. And I often refer it to make it easy for me to remember, understand. It's kind of like a relief, right? A relief from doing the chores, a relief from doing homework. I also want to talk about the difference between natural reinforcement and artificial reinforcement, especially when we're looking about teaching new skills that are not happening frequently. So the natural reinforcers are directly related to the behavior. There is a natural sequence. They follow spontaneously the behavior. So for example, I'm asking for juice and I'm getting the juice. Artificial reinforcement is not a natural consequence of the behavior that has the purpose of really getting that skill that the child is not able to exhibit to increase more faster. So for example, I'm getting a sticker for brushing my teeth. All right, let's look at some example of positive reinforcement as we are kind of now incorporating the ABC of behavior like we broke them down earlier. So in this first example, the antecedent is the teacher saying, time to sit down, kids. The behavior is that the children are sitting at the desk, and the consequence is the teacher saying, good job, and giving a sticker. And that results in the children then engaging in that behavior of sitting down the next time that the teacher says, come and sit down. So again, the teacher is giving something positive that the children like, which is social praise and a sticker. Second example, our antecedent is Johnny is hungry and wants chips. The behavior is he's pointing to the chips, but he's also screaming and throwing items. And the consequence is the mother give him the chips. So regardless if that's a good or bad consequence to give Johnny at that time, we want to look at is that consequence going to increase Johnny doing the same thing next time that he wants chips and he's hungry. So most likely in this case, that's going to happen because mom gave him exactly what he wanted. Third example, antecedent is parent asks the child to take out the trash. The behavior is that the child takes out the trash, and the consequence is that the child gets to watch a favorite TV show. Again, so adding something wanted. Let's look now at examples of negative reinforcement. So remember, negative reinforcement, we're taking away something that the individual does not want to do. So a form of relief. So alarm clock sounds, hitting the alarm clock is my behavior, and the consequence is the alarm clock turns off. So my behavior of hitting the alarm clock is going to increases in the future because of that consequence that I get, right? Of that relief from the sound of the alarm clock. Second example is the parent says clean up the blocks. The behavior is the child screaming no and refusing to clean up. And the consequence is the parent cleaning up the blocks. So the child has that relief from having to do that aversive task. The third example is the loud vacuum cleaner sound. The behavior is the child screaming and hitting mom. And the consequence is that mom turns off the vacuum cleaner. So again, relief from an aversive stimulus that, however, is going to increase the behavior of screaming and hitting next time that the antecedent is presented of the loud vacuum cleaner sound. So let's dive into more practice. Again, like I said, these are sometimes confusing to most of us, and I want to make sure that we can take some time and dive into dissecting some examples. So in this scenario, what we're going to do, we're going to break down into the ABC, and then we're going to identify what type of consequence was given. So we're going to use the same exact scenario that we analyzed before, so that it helps us really understand the concept. So it's time for bed. Mom asks Johnny to brush his teeth. She gives him the toothbrush. Johnny throws the toothbrush on the floor and runs to his room. Mom screams, "Johnny, come over here." Mom is exhausted, and after screaming for 5 minutes, she goes to Johnny's room and kisses him goodnight. Well, next time, when asked to brush teeth, Johnny refuses to brush the teeth. And so let's see what our ABC of behavior are. We talked about the observable action, Johnny throwing the toothbrush and running to his room. What happened right before that request to brush teeth is our antecedent. And what is the consequence? What follows the behavior is that mom screams for 5 minutes, kisses him goodnight, and Johnny does not have to brush his teeth. All right, the second scenario, we're gonna do the same thing, break it down into ABC and identify the type of consequence. Mary's mother is on a phone call for work. Mary begins to scream louder and louder. Her mother tells her several times to be quiet, but Mary continues to scream even louder. Mother is having a difficult time attending to the phone call and politely hangs up. She looks at Mary and says, "What do you want, child?" And every time that mom is on the phone, Mary engages in that same behavior of screaming. So our observable action, that behavior, is Mary beginning to scream louder and louder. The antecedent that triggers that behavior is the mother being on the phone, not paying attention to her. And what is the consequence? What follows the behavior is mom telling Mary to be quiet, hanging up the phone, and asking her, "What do you want, child?" We know that behavior increases in the future, so it's a reinforcement, and it is negative or positive. In this case, it's positive because we are adding exactly what Mary wants. Regardless if it's a reprimand, right, or what we call negative attention, she's still getting mom's reaction and mom to actually stop the phone call and attend to her. All right, this is a little activity. You also have it on the workbook that we provided for you. And these are just some questions that are important when we are looking at selecting reinforcers and setting up reinforcement contingency to increase the desired behaviors. And we're gonna guide you through some important aspect of reinforcement in the next few slides. But these are, for example, some questions I would ask parents, right? Working with Johnny, and just say, okay, well, what does your child do in his free time? Does he engage in any sensory activity? Some of the individual with autism that I work with, they don't have appropriate play skills. So they don't play with blocks or read a book or play, with siblings appropriately, right? They might just line up their cars, right? Or they might like to play with water, right? Whatever that activity is, what is it they do in their free time? Also, what are their preferred things to eat or to drink? What are some people that they like to spend time with, or they maybe just like their attention? What are some specific toys or items that they like? There are maybe some places they like to go to, maybe some specific activities that they like to do, maybe watch the iPad, watch, YouTube or video games. And this kind of guide us to our next session in talking about effectiveness of reinforcers and what are some implications and consideration for this concept. So selecting effective reinforcers, right? We talked about reinforcement increases behavior. So selecting effective reinforcers through assessments, through preference assessments, actually, like the brief one that I showed you earlier, help us identify what are some things that we can do to increase new skills and increase appropriate behavior, increase those lagging skills. And I always tell parents that making sure that we have an understanding of the child reinforcement system and what they like to do and getting into their world is going to be our best friend in really being able to establish connection and really increasing those positive and necessary skills that they need. And so there are 4 principles that guide us in ensuring that a reinforcer is effective. And there are, you can remember it from the acronym DISC, and they are deprivation, immediacy, size, and contingency. So we're gonna explore each one of them with some examples. We're gonna explore the case study of Johnny. He loves ice cream, and what we wanna do is increase his skill of completing a daily schedule. And I'm gonna make a quick note here that although we're talking about adding a reinforcer to increase a skill, we can see that the ice cream, it's not necessarily a natural reinforcer of completing a daily schedule, right? If you and I complete a daily schedule today, we don't necessarily get ice cream. But after we build rapport with Johnny and establish that connection through the use of these artificial reinforcers, we'll be able then later on, once those skills are established, to fade those artificial reinforcers to more natural, like developing what we called inner motivation or intrinsic motivation. So let's look at what's deprivation. So answers the question on when was the reinforcement last accessed. So this is really the amount of time an individual has been without the reinforcer. So we know when a child has, or an individual has been deprived of something by the body cues, right? Like typically, if you are, showing even ice cream or something favorite to a child and they haven't had it for a while, what do we see? The first thing that I see is like big eyes of excitement, right? And then the opposite though of that, we want to be aware that it's satiation or also saturation. So when I have had too much of that reinforcer, that reinforcer is gonna lose effectiveness. And so here are differences of the examples, right, of an effective example and ineffective example as it relates to deprivation. So for example, Johnny favorite treat is ice cream. He hasn't had it in 3 weeks and he gets ice cream after completing his schedule. So that would be an effective example where the ice cream is going to then increase the behavior of completing the schedule. And an effective example would be Johnny has ice cream every day after lunch, and then Johnny's mother will tell him, we'll do your schedule and then you can get ice cream. What's happening that he's probably satiated so much already of getting that ice cream every day. The second principle is immediacy. So when will the reinforcement be delivered? So how soon after I engage in the desired behavior will I receive that reinforcer, right? And we want to be careful in engaging in false promises. Sometimes I see this too often with working with parents where we are trying to get a quick response from a child and I'm going to promise that I'm going to take to Disneyland and I'm going to do all these things, while that might not be the case immediately, right? And so then that's when we see behavior decreasing because I'm not receiving that immediate reinforcer. So in the case of Johnny, an effective example would be that Johnny's mother immediately gives Johnny ice cream upon him completing the schedule. The ice cream is ready, she has it in the fridge and it's ready for him to go. An ineffective example would be Johnny completing his schedule and Johnny's mother saying, oh, okay, I will go to the market this weekend to buy ice cream, right? Or maybe realizing that as she's opening the fridge, like, oh, we're out of ice cream. So that will not work well in increasing that scale. Third would be size. So how much reinforcement should be delivered, right? So want to keep in mind that the more worthwhile, so effort to value relationship, right? That the amount of reinforcement, then the more effective that reinforcement will be. So depending on the effort, right, that the individual is putting in completing that task, engaging in that appropriate behavior, we want to make sure that we compensate it with something adequate, right? We also want to keep in mind and balance, though, in terms of avoiding that satiation. So let me guide you through an example. So an effective example would be Johnny's mother giving him 1 scoop of ice cream upon Johnny completing his schedule. And ineffective would be only receiving a little tiny spoonful of upon completing his schedule. Maybe the schedule had 5 different tasks, and for Johnny, it's a lot of effort to focus and coordinate all those multi-step. And the fourth is contingency. So answering the question, is the reinforcer directly impacting the behavior and only the behavior that we want to increase? So the reinforcement will be delivered only after the desired behavior to increase, and only that. Let me show you an example. So an effective example would be Johnny's mother giving ice cream only and only if he completes his schedule with no excessive behaviors and within a set time, let's say 30 minutes. An ineffective example would be Johnny's mother gives ice cream when he completes a variety of skills. So that could be his schedule, when he dresses, when he uses the toilet, and even if sometimes when he screams as he engages in completing the schedule. So what's happening here is that not only the completing schedule behavior is going to get reinforced and increase in the future, but then all the other skills, which dressing and using the toilet is fine, but also screaming included in that category. And also here, if we are reinforcing with the same item multiple skills, we might run into satiation issues. All right, I do have a little group activity for you guys. And if you have, again, your booklet, we are on page 15. So our first scenario, Johnny is a 4-year-old young boy, and his favorite treat is M&M. He's working on toilet training. Sometimes he runs to the toilet on his own, and some other times his mother needs to carry him while he's crying and kicking. His mother gives him a pack of M&Ms every time he urinates in the toilet. So it seems that he receives the M&M regardless if he is going on his own or also when mom needs to carry him. So again, you're gonna let me know if this principle of reinforcement, such as deprivation, immediacy, size, and contingency, are kind of being applied in that example. Okay. And the second example is Jane is a 3-year-old and she has a favorite purple dinosaur, Dino. Jane carries Dino everywhere, and when her mother is trying to dress her in the morning, Jane runs around the house with Dino laughing as her mother is chasing her. Her mother tells her that if she doesn't let her put on her clothes, she will take away Dino. I'm going to leave up these examples on the screen so you can refer them back. And then again, if you have our workbook, we are on page 15 and you have a little chart. Just write deprivation, immediacy, size, and contingency, and just kind of tell me for each scenario, okay, does it look like the M&Ms were deprived? Yes or no? How about immediacy? And so forth. So for example, I would kind of check each principle, right? So deprivation. So is Johnny really deprived by these M&Ms? Yes or no? Well, it looks like, right, he's receiving, at least receiving the M&Ms only for the toileting program, let's say, right? However, so I could say that he's deprived because it seems that he's receiving it only for that. However, when we look, and I'm going to jump a little bit in the principle, when we're looking at contingency, so are we only reinforcing toileting skills or also toileting and some other behaviors, right? And so when we look at where he says, well, his mother sometimes must carry him while he's crying and kicking, well, if he's receiving a pack of M&M after that, then we're reinforcing also those crying and kicking behaviors. So he will get a yes for deprivation and a no for contingency. Now, the other two principles that we have is immediacy, right? It's not specified in the example, but I could assume that, yeah, probably right after he's done urinating, mom immediately give him the chocolate. So that would be a yes. In terms of the size, that's now an interesting one, right? Because if we're looking at a toilet training program, most likely Johnny needs to go to the restroom, you know, several times in the mornings and in the afternoon throughout his day. And so if every time I'm going to give him a full-size pack of M&Ms, that's definitely not going to be good for his health, right? A lot of sugar, but also is going to satiate him pretty quickly. So he, in terms of our chart and kind of analyzing the effectiveness of that reinforcer, you will get a no for the size. And so, for example, number 2, the same thing. We'll kind of go through each of the principle and kind of see yes or no. So for deprivation, doesn't look Jane is deprived of her dino at all. Right? She always has access to it. She carries it everywhere. So no in terms of deprivation. Immediacy also, she would get a no because again, she always has access to it. And even when she is not cooperating and running around the house, when mom tells her to put on her clothes, she has dino with her. In terms of the size, it's also, and this is a good time for me to clarify, this is also how much time I have with this item, right? Or how long am I playing video games for? So that really also doesn't apply here because she always has access. She always have time with dino. Also, in terms of contingency, it doesn't apply, right? Because again, it's not you're gonna put your clothes on and then you have access to dino. It's kind of the other way around. Well, if you don't put your clothes on, then I'm gonna take dino away. So definitely dino, it's not working as a reinforcer to increase the behavior of Jane to be more independent in dressing. Move on to our summary of reinforcement. So understanding how reinforcement work, it's really important in understanding which behaviors are increasing. And so again, behavior can be appropriate or inappropriate. So we can ask ourselves, well, am I increasing any maladaptive behaviors? And also, am I increasing the appropriate behaviors? Or what can I do to make sure that then I'm increasing dressing independently, toileting independently? Talked about reinforcement, again, that it can be used to increase desired behaviors, teaching new skills like brushing teeth, doing homework, and so forth. We also talked about that just because Johnny likes something, does that means that it's a reinforcer? No, he needs to meet the reinforcement effectiveness criteria, and it also needs to lead to increasing a behavior, right? So just because Johnny likes video games doesn't mean that video games are a reinforcer for him to increase any behavior. An item activity person is a reinforcer, again, only over time the behavior follows increases. And then we just talked about and dive into some example of what makes reinforcers effective. And we talk about the DISC, so deprivation, immediacy, size, and contingency. And this leads us to another small break. We talked about reinforcement. Now let's dive into understanding punishment, and like we talked about, decreases behaviors in the future. And so in this case as well, we have positive punishment, which is adding something that it's not wanted, and that could be an extra chore, an extra homework, an extra activity, any unwanted outcome. Or negative punishment, which is taking away something wanted. So taking away a favorite toy, a favorite item, access to an activity, not giving access to a person, attention, or a wanted outcome. So let's dive into some examples to clarify again this complex of concept of positive punishment. Our first example is antecedent. The parent says, clean up the blocks. The behavior is child screaming no and throwing the blocks. And the consequence is the parent requires the child to pick up the blocks and also the trains. So there is an added task that is non-preferred that is being added to the child. And as a result, the screaming of no and throwing blocks will decrease in the future. A second example is antecedent of being late for work, triggering the behavior of speeding, and as a consequence, getting a ticket. So again, we get something that we don't want, traffic ticket. Third example is child is unengaged during his free time. That is our antecedent. The behavior is the child salivating and spreading the saliva on the table. And what is the consequence? The child is required to clean up all the tables in the house. So we're adding something aversive that the child does not want to do. Now let's talk about negative punishment. So taking away something wanted. Our first example, the antecedent, we have the iPad has no more battery. The behavior is throwing the iPad, and the consequence, it's the iPad breaks and can no longer be used. So I no longer have access to that iPad that it was my favorite thing. Second example is mother is playing with siblings. The behavior is Johnny screaming, throwing items, and hitting brother. And the consequence is that mother gives Johnny timeout and ignores him. There's no attention. And so again, taking away something that Johnny likes will decrease eventually that behavior of screaming and throwing items and hitting brother. Third example, our antecedent is the parent asks the child to take out the trash. The behavior is child taking out the trash, and the consequence is the child does not receive positive praise and cannot watch his favorite TV show. So that's an example of taking away something that the child really likes, and in the future, well, maybe Johnny is not going to taking out the trash anymore when asked to do so. All right, so we're gonna dive into some more examples of punishment, and we just touch base that punishment happens after the behavior and is going to decrease the future frequency of that behavior. And these scenarios are gonna help us digest this a little bit more. So we're gonna again identify and break down into the ABC, antecedent, behavior, consequence, and then we're gonna identify the type of consequence. Now, I just wanna put a disclaimer out there that just because we're reviewing these examples and just for the purpose of illustrating punishment does not mean that it's the correct way to address that specific behavior or that is a strategy that we should utilize, especially when it comes to punishment. And I will review some ethical consideration a little bit later on that. So it is time for bed, and mom asks Johnny to brush his teeth. She gives him the toothbrush. Johnny throws the toothbrush on the floor, runs into his room, and mom follows him with the toothbrush and with hand over hand help, so prompting him. Then he can brush the top part of Johnny's teeth. Before going to bed, however, because of Johnny's behavior, mama requires him to fold some towels, which is a task that he doesn't like to do. And in the future, over time, Johnny no longer throws the toothbrush when asked to brush teeth. So our ABC, our behavior is Johnny throwing the toothbrush and running into his room. The antecedent, what happens before the behavior, is that request to brush teeth. And what happens after the behavior is that mom follows Johnny, requires him to brush teeth with the prompt, but also requires him to fold towels. And we learned that he does not like to do that task, right? So mom is adding an aversive task that Johnny does not like to do. And so this is positive punishment. We have learned that the behavior of Johnny throwing the toothbrush and running into his room is decreasing in the future. Okay, so positive punishment, adding something that Johnny does not like to do, decreasing his behavior in the future. Okay, we have a second example, same thing. We're gonna break it down into our ABC and then identify the type of consequence. In this example, Mary's mother is on the phone call for work. Mary begins to scream louder and louder. Her mother tells her several times to be quiet, but Mary continues to scream even louder. Mother is having a difficult time attending to the phone call, sends Mary in timeout to her room until she's done with the phone call. In the future, over time, Mary no longer screams when her mother is on the phone. And so if we want to break it down into our ABC, the behavior is Mary beginning to scream louder and louder. What triggers that behavior? What happens right before that? That antecedent is mother being on the phone call, not paying attention to Mary. What's the consequence? What happens after the behavior is mother telling Mary to be quiet and sending her to timeout in her room. And so here we have the behavior is decreasing in the future. So that's punishment. However, is it positive or negative? I'm adding something aversive or I'm taking away something that Mary does not like. So in this case, it's negative punishment because I'm taking away the attention component that Mary likes so much by sending her in timeout. So here is exactly what I was sharing a little earlier, some ethical consideration regarding punishment. So the BACB, which is the board behavior analyst, requires us to use reinforcement before we use any punishment procedure, sort of like the last resort, right? Because we need to ensure that we're always using the least restrictive procedure when we are dealing with problem behaviors. We want to ensure patients' right to effective procedures and patients' right to safe and humane treatment. So really the reinforcement is the focus of our treatment and punishment only as the last resort. And every time that if we need to get to that point where punishment needs to be used, it needs to be number one, if reinforcement procedures that we have used have not worked, or in combination with the reinforcement procedure, and also ensuring that we are increasing those lagging skills, those skill deficits that we had talked about and mentioned earlier. I have a little example letter video that I want to show you. And so if you have your workbook, you'll see this little chart. And basically what we're doing is, again, the same thing. We are practicing breaking down a scenario or a situation into our ABC of behavior, antecedent, behavior, and consequence. But now we're also detecting, is it reinforcement? Is it punishment? What's happening after, right? That consequence? Is it positive punishment, negative punishment, or is it positive reinforcement or negative reinforcement?
Ruben, no. Don't do that.
No.
Do you want your chocky?
No.
You gonna put your bib on?
No.
Well then, no chocky. I know exactly where it is. I know it's over there. Are you gonna put your bib on?
No.
Well then, no chocky. You're gonna hurt yourself. done?
Sorry.
Are you finished? You chocky? Yogi?
Yeah.
Bib on?
No.
No yogi.
Sorry.
Bib on?
No.
No lovely then. So you put your bib on,
No.
put your bib on, and then you can have your yogurt and you can have your chocky. If you put your bib on.
No.
Oh well, no chocky, no yogi for you then. What? Do you want to cuddle?
Yeah.
Calm down then. Calm.
Sorry.
Chocky, get your bib on then.
No.
Well then, no chocky. I'm sorry, Ruben, but this is hilarious. This is gold. You done?
Yeah.
Sure? Do you need a cuddle?
Yeah.
You going to stop being horrible?
Yeah.
I thought so. Okay, 1 minute.
So hopefully you tried on your own to kind of dissect this scenario. And it wasn't until maybe a little bit later in the video that we clearly were able to identify, okay, what is the antecedent? We kind of knew already the behavior of the kiddo, right? That it was this screaming, the high pitch, then it became no, then it became hitting the table, hitting the chair. But the antecedent, then we kind of heard a little bit later in the video where mom was just say, okay, first you put your bib on, then you can get chocolate milk, and it looks like he wanted also some yogurt. And what was mom's consequence? She didn't give him the chocolate or the yogurt until eventually he would put the bib on. And so in our question reviewing examples of reinforcement and punishment, what do you think that is? Eventually what mom is doing is decreasing that behavior of screaming and crying, right? By taking away something that it's wanted by this kiddo. So she's providing punishment procedure, right? Negative punishment. And so again, we talked about the ethical consideration on that. And what we wanna probably do and kind of switch is instead reinforcing that bibon, I give you the chocolate milk. And because the kiddo is very small, and we want to make sure that we build that repertoire of skill. And there is one strategy that we'll touch base in a little bit later on called errorless learning, which we might just provide the child with an opportunity to make no mistakes. So it looks like mom is asking him, well, maybe he doesn't have the skills yet, or just maybe build up that tolerance of tolerating the bib on. And so maybe she can help him and then immediately giving him the chocolate milk. So that would be how we would switch that kind of intervention. And I gave you kind of a little bit case study, but it's important to kind of notice the different approach, where one it's a punishment and one it's really reinforcing and focusing on that of the appropriate behavior. So feel free to have questions. Yes, go ahead.
Okay, so if mom would have gave in and gave the chocolate or the pudding or the toy or whatever it was, that would be considered a positive reinforcement to the negative behavior.
Exactly. If mom would have given, she would have added something preferred, right? and that would have increased the future frequency of the crying. So next time that he wanted chocolate and he was said, no, first put your bib on and then chocolate, could we probably guess what he was gonna do? Yes, the exact same behavior, because it worked for him just the other day. Moving on to our little summary. So we talked about punishment, and it helped us identify which behaviors we're trying to decrease, which behaviors are not occurring, and why. But we also talked about that we need to take in consideration the ethical consideration of using punishment, and we must use it only in combination with reinforcement of the appropriate behavior, and if all reinforcement procedures have not worked to decrease that behavior. The functions of behavior, and if you have our booklet, should be on page 20. And so again, just a refresher, we talk about how behavior is maintained and affected by the environment, so that antecedent and that consequence. And when we're trying to understand why behaviors occur, we typically look at the antecedent, right? We just talked about reinforcement and punishment, and we were looking more at the consequence, what happened after the behavior. Now we're focusing more on the antecedent. So why it's so important to understand and really find out why the behavior or an individual is displaying a particular behavior? Well, because each function, right, has a specific intervention, and especially if we're looking at decreasing maladaptive behaviors, then we really want to make sure that we have effective strategies that are research-based, that are proven that if we follow the plan, then we are providing the best care for the individual in reducing the problem behavior, ensuring safety. 4 functions of behavior, and there are 4 functions as why individuals engage in the behaviors that they do. The first one is escape, attention, second one, third one, access, and self-stimulatory for the 4th one. So what we're gonna do, we're gonna review each one of them with some example and scenarios. So the first function, escape. What does that mean? Well, the individual is engaging in that behavior because they want to escape. They want to avoid something that they don't like to do. And in the past, engaging in this behavior resulted in avoiding that particular unwanted task. So I'm avoiding cleaning the dishes. I'm avoiding playing the ball, right? The antecedent is typically an instruction to do something, or just the presence of the stimuli that signals a demand is about to happen. So for example, a child might relate the signal of a bell ringing from recess as a signal to go back to class. Nobody's necessarily verbally telling him go back to class, but that's a stimuli that signals that. Why individuals engage in problem behavior that are escape driven? Mainly for these 3 reasons. There is an overall lack of motivation, and this specifically we see it with diagnoses such as the autism spectrum. There is a lack of skill. So again, we're talking about the skills that are missing. It might be too difficult to engage in that replacement behavior. There might be again, some disability that are impeding the individuals to have learned those organically as they grow. There might be some sensory aversiveness, which we also often see with our individuals with autism. And so the example, and remember what we talk about, right, that behavior can be appropriate or can be problematic or maladaptive. And so if my instruction is, let's do a math worksheet, I can engage in the appropriate behavior to escape that task. And I can just say, no, I don't want to do math right now. But if I don't have the skills to say that, I might just start throwing the toys on the floor and start screaming. And so here are some examples where the function of the behavior is for escape. As the antecedent, the alarm clock sounds, the behavior is hitting the alarm and the alarm clock turns off, right? My behavior of hitting the alarm is to escape that sound continuing. The second example is parents said to clean up the blocks, again, an instruction. The child screams no, refuses to clean up. What is the consequence? The parent cleans up the blocks. So again, the behavior of screaming no, and then it seems that it's working because Johnny does not have to clean up the blocks. It's serving the function to escape that instruction of cleaning up the blocks. The third example, parent asks the child to put on the shoes. The child says, I don't want to. And then the child does not have to put on the shoes. So here we have an example of I'm properly requesting that I don't want to do it. And the behavior is getting reinforced by allowing you to just have a break and don't have to put on shoes. We're gonna look at a scenario and do a practice exercise. And I've used some of the scenarios from previous slide to help you kind of connect the dots between all these concepts. So here again, we're gonna break it down into our ABC and then we're gonna identify the function. So in this scenario that we have reviewed before, it's time for bed and mom asks Johnny to brush his teeth. She gives him the toothbrush. Johnny again throws a toothbrush on the floor, runs to his room. Mom screams, Johnny, come here. Mom is exhausted, and after screaming for 5 minutes, she goes to Johnny's room, kisses him goodnight. And next time when Johnny is asked to brush teeth, he refuses to brush them. And so the behavior, Johnny throwing the toothbrush, running to his room, the antecedent, the request to brush teeth, and the consequence, mom screaming for 5 minutes and kiss him goodnight. Johnny does not brush teeth. And so our antecedent is really a cue to tell us that it's an instruction happening. And regardless if Johnny's behavior is appropriate or not, we know that he wants to escape that task, that request of brushing teeth. And so here what we're going to do, we're going to analyze and provide some strategies that we can implement before the behavior happens. So modifying the antecedent and after the behavior happens, so the consequence based on the function of escape. And so we are talking about antecedent strategies. Antecedent strategies so are things that we're going to implement even before asking Johnny that particular instructions, right? And the goal of implementing antecedent strategies is to prevent that maladaptive behaviors will occur, right? And they are specific to the function of behavior. So always, first and foremost, I want to make sure that I have that there is motivation and I've established rapport with that particular child or individual that I'm working with. We need to make sure that there is trust and safety and that we have spent some time engaging in some favorite activities so that learning can happen. And then I'm going to be priming and setting some clear expectation for Johnny. So maybe I can start 15 minutes before telling him to brush teeth. I'm going to start saying, hey, in 15 minutes, we're going to brush teeth. And then if you brush teeth, then you can access X reinforcer, right? We're clearing, setting up the stage for a good, clear expectation of what's going to happen. And for some of our learners, they need to have a visual support, a schedule, maybe a picture. We also use a lot the first then board, where it's like, okay, first brush teeth, then this is gonna happen. We might have to engage in what we call, then I refer back to this term, errorless learning, where I might have to hand over hand teach Johnny how to brush teeth, maybe model that for him, and arrange maybe the environment as well. If Johnny, for example, is throwing things or running away, right? I might have to ecologically arrange the environment so there are no maybe fragile things that he can break, so he doesn't have to get hurt. choices are another really great strategies that gives the individual a sense of control, that they're part of what we are, what is going to take place, but it's a choice that is kind of forced, right? So I might say, well, do you want to brush your teeth with your orange toothbrush or with your yellow toothbrush, right? We are still brushing teeth. We're just providing some shared control on the choice. We might say, do you want to go into mom's bathroom or you want to go into your bathroom to brush teeth? We might want to implement what we call behavioral momentum. So instead of maybe transitioning from watching a preferred video and going to an aversive task of brushing teeth, I might slowly engage Johnny into a more neutral task, and then provide some reinforcement and again, building rapport, and then transition him to the bathroom. And so I might say, hey, do you want to, play a little game of hide and seek, or do you want to, skip and go to my room and help me with something, right? As we get closer to the bathroom, to then just say, hey, we're going to brush teeth. So that's called behavioral momentum. And then we also want to provide opportunities to teach Johnny how to request a break appropriately from any situation that he doesn't want to, he might request a break, right? An aversive task. And then we want to reinforce it. For some of our students, it's verbally saying a break. For some other, it might be to use an assisted device or a picture or sign language. Right? And then eventually over time, we also want to teach to tolerate the task and eventually to independently be able to learn how to brush teeth. And then we are looking at consequence strategies, right? So if we have implemented all of these strategies and we're still seeing maladaptive behaviors occur, then we need to implement a consequence strategy. So modifying the environment after the behavior has occurred in such a way specific to the function, so that maladaptive behavior doesn't continue in the future. And so this is what it would be appropriate to implement an escape extinction procedure. So we need to follow through with the demand. And we're going to talk about a concept called extinction burst a little bit later on, where behaviors might increase before getting better just because we're modifying the environment. But I'll touch more deep, and I'll be in more details later in a little bit to discuss that. And then other strategy would be redirection and then reducing the task or task reduction. So in the example of Johnny, I might not follow through when he's kicking and screaming from his room to redirect him back to the bathroom and having him clean his teeth. So I might have to maybe bring the toothbrush to his room and maybe just even hand over hand just for him to touch his lips, right? And for today, that would be better than for him not at all have brushed teeth and kind of reinforce that whole maladaptive behavior that he was engaging in. We're going to do the same type of scenarios and explanation for the other function now, attention. So the individual will engage in the behavior to getting attention from someone, and in the past, this behavior has resulted in getting the attention. And again, it could be positive attention and it could be negative attention in the form of a reprimand or a scolding. And this could be, from others, so like mom, teachers, peers. The antecedent is typically a lack of attention, and some cues that tell us that the behavior is for attention is that typically the individual, while they're engaging in the maladaptive behavior for attention, they will look for others' reactions. So they might be laughing, they might be looking at mom, they might be smiling. And some of the lagging skills that we see when there are attention, maladaptive behavior for a function of attention are, again, lack of skills. So inability to communicate appropriately that they need that attention, inability to wait and tolerate waiting, which is a difficult task, right? Patience for most of us. And then lack of intrinsic motivation or sense of belonging that needs to, really be satiated. And so again, we might have, if the antecedent is that the teacher is busy, I might have a child saying, teacher, look at my drawing. And that would be an appropriate way of requesting attention. On the contrary, I might have somebody getting out of seat and hitting a peer for attention, but this now is a problematic behavior. And here are some example for the attention function. So if my antecedent is I see a friend coming towards me, the behavior, I will greet the friend, and what's the consequence? Well, the friend greets me back and engages in a meaningful conversation for a few minutes. The behavior of student raising the hand, the antecedent is teacher is talking about math lesson. What's the consequence? That the teacher calls on the student to speak. That will be an appropriate way for requesting attention from the teacher. And the third example, the Piers is not playing with Johnny. So Johnny's behavior is that he takes his pants off at recess. And the consequence is that Piers look at him and starts laughing. And that's an example of an inappropriate behavior. And the laughing and the start, and the look of the peers, it's providing attention and reinforcing that behavior. We're gonna review a scenario, identify the ABC and the function. So Mary's mother is on the phone call for work. Mary begins to scream louder and louder. Her mother tells her several times to be quiet, but Mary continues to scream even louder. The mother is having a difficult time attending to the phone call and politely hangs up. She looks at Mary and says, "What do you want, child?" And every time the mom is on the phone, Mary engages in screaming. So again, our behavior is Mary beginning to scream louder and louder. What happens before the behavior is that mom is on the phone call. She's not providing attention to Mary. And the consequence is that mom ends up hanging up the phone and then asks her, "What do you want, child?" So provides attention, even if in the way of a reprimand, right, or negative attention. And so this is an example of attention function. And so again, we're going to review in this case, what are some strategies that we can implement even before getting on that phone call to prevent the behavior from happening. And then should we not be able to prevent the behavior, what can we do as a consequence strategy? So again, before the behavior occurs and before going on that phone call, well, I definitely want to keep working and still make sure that I am establishing rapport with the individual and maybe satiating a little bit more that attention. So maybe before going on a phone call, I need to spend 10 minutes with Mary and maybe do like a favorite activity that she wants to do. And then I want to prime her and set clear expectation and just say, you know what, in 15 minutes, mommy needs to go on a call. But then when I'm done with the call, what activities would you like to do with me? And then here again, we have the choices. So Mary feels part of this engagement and this relationship. Again, if Mary is engaging in some disruptive behavior, I want to look at the environment and make sure that she is safe. A lot of individuals that engage in attention-seeking behavior engage in a lot of unsafe behavior. So I had, individuals playing with fire and breaking items, and because that has worked in the past in catching the adult's attention in the room. We want to, on the lines of establishing rapport, engage in what we call non-contingent reinforcement, or NCR, which basically is that throughout the day, I'm going to catch Mary behaving and I'm going to provide social praise. I'm going to give her a hug. I'm going to tell her that I love her. Again, satiating that attention so that she does not need to seek my attention by engaging in a maladaptive behavior. And then I also want to provide opportunities for her to learn how to request attention appropriately, and also provide opportunity to wait, right? And learn how to be patient and tolerate that waiting. And we can do that with the use of timers, with the use of visual schedules and visual supports as well. And should all these strategies not have worked, and especially at the beginning as we're trying to try to change the maladaptive behavior, because there is a history, right, of Mary engaging in that maladaptive behavior, we are not going to be successful at the first time to prevent the behavior, right? So we want to make sure that we know what to do if the behavior happens. And so we will engage in what we call the attention extinction. So at that moment, we're not going to provide attention, and we're going to engage in what we call planned ignore, which is not completely ignoring the child. We are going to be vigilant of what the child is doing, and engage in what we call the peripheral vision, right? We're not going to look at Mary directly in the eyes, but we can kind of track what she's doing and make sure that she's safe with the corner of our eyes. We're not going to engage in reprimand, negotiation, arguments. We're going to keep quiet and most likely be prepared for Mary increasing her behaviors at the beginning, because that behavior worked for her in the past. So maybe she might be screaming a little louder. She might throw some things, and we'll talk later about the extinction burst. And then when Mary is more calm, then we're able to reinforce that behavior and then go back to engaging with her and build rapport again. We're gonna jump into our third function, the function for access. And so we're reviewing the function for access, and individuals engage in the behavior to gain access to something wanted. It can be an item, an eatable, a toy, an activity. And in the past, this behavior has resulted in accessing something wanted. And so the antecedent, it's typically the motivation to get this desired item, and maybe they've been deprived from that item, and also the denial of access to such item, like we saw in that video, denial to the chocolate milk. Typically, individuals that engage in maladaptive behaviors for the function of access, they lack the fundamental skills for communicating their needs appropriately, tolerating waiting, tolerating transitioning from a highly preferred item to a non-preferred task. So we're going to be reviewing some examples like we talked about before. Behavior can be appropriate or problematic. And so I might engage in an appropriate behavior to ask for what I want, such as, may I have more time on the iPad, please? But I could also just scream and kick mother, right? As a means to communicate my want to access that particular iPad, for example. And here are some additional examples of the function for access. So our first one, the antecedent is being hungry. The behavior is asking, can I have a sandwich, please? And the consequence is getting that sandwich. The second example, the bell sounds signaling that recess is over. The behavior is Johnny screaming, he runs to the swing, and the consequence is that the teacher is waiting for 20 minutes as Johnny swings on the playground. The third example, Johnny's brother is playing with trains. The behavior is Johnny says, can I play now? And the consequence is that Johnny is now able to play with the trains. And so we're going to go over a little scenario. We're going to break it down, identify our ABC, and then identify the function. And so the scenario, Johnny's mother tells him it is time to put the iPad away. Johnny starts screaming and kicking his mother, and Johnny's mother talks to Johnny, trying to convince him. Meanwhile, Johnny is not responding. He continues to watch the iPad. And next time when Johnny is asked to put the iPad away, he engages in the same behavior. So our observable action or response is that Johnny screams and kicks mother. The antecedent, so what triggered that behavior, is that request to put the iPad away, so denied access to something favorite. And the consequence is that mother tries to talk to Johnny while he continues to access what he wants, to watch the iPad. And so again, we're going to review some strategies that we can use to prevent the maladaptive behaviors for access, and then some consequence strategies as well. So again, very important. I'm going to continue repeating. We're going to make sure that we want to establish rapport and motivation with the individual. so that they feel safe and trusted in this learning process. We want to prime and set clear expectation. So instead of just saying, turn off the iPad now, I might say, okay, remember, Johnny, we're going to turn off the iPad in 20 minutes. I'm going to start setting a timer, right? And then maybe every 5 minutes increment, I'm going to say, okay, we have 15 minutes left. We have 10 minutes left. And again, we could do that with visual support and schedules with first and contingency. So maybe first we're going to do an activity and then you're going to get iPad again. So if, especially for learners that are so rigid in their leisure skills, right? In the array of activities that they do in their free time, they tend to be very resistant in letting go, and that let's say kind of unknown of when I'm gonna get my favorite item back, it really is anxiety provoking. And so using the visual support and telling them, hey, don't worry, we're gonna just do this simple thing and then you can have it back right here at this time or right after. Again, we can present choices. So yep, we're denying access to iPad, but these are the two choices of activities that we can do after that. We can engage the child in errorless learning to teach him again how to request desired item appropriately. Some learners don't have the verbal ability to tell us, but we can use sign language, pictures, signaling our items or augmentative devices, and then tolerating, accepting no, and then reinforce those behaviors. And then again, like we saw before, always looking at ecologically arranging the environment should, the child engage in disruptive behavior where he might hurt somebody or he might engage in property destruction. And so again, if we are not able to prevent the behavior at that point and the behavior happens, then we are going to implement the access extinction, which is we're not going to give access to that item. And that might trigger that extinction bird, that increase in behavior. And for somebody, an individual that might be older and resisting to give the iPad, we definitely want to be careful in not engaging in power struggles. We might have to look at deactivating the internet or having some sort of parental control where some features of the preferred activity on the device can be temporarily paused to ensure that we are not reinforcing that maladaptive behavior. And lastly, we're going to cover the self-stimulatory function. And individuals engage in this behavior because it's internally reinforcing to them. And it's one of the behaviors that is the most difficult to identify because it's happening internally. And so it could also happen for pain attenuation, to cope with overstimulation, to cope with lack of stimulation or being unengaged. And especially for individuals with disability that already lack the communication skill to tell us how they're feeling, it's definitely a tricky one to fully identify what specifically is the trigger for that self-stimulatory behavior. And there are definitely internal medical causes that might trigger some self-stimulatory behavior that look like more of a self-harm, right? So we might have an individual that engages in hitting their head on the wall, and that might be a self-stimulatory behavior. And so we really need to look at if there's something medical that it's hurting that individual that we need to take a closer look at. And we want to also be careful to identify the self-stimulatory behaviors that are part and are characteristic of a diagnosis, right? Like, for example, on the autism spectrum. And we know that one of the characteristics of the diagnosis is the repetitive and stereotypical pattern of behaviors where I might be liking to spin around or engage in manner movements. And so again, being conscious of reducing those self-stimulatory behavior to a level that allows learning and social interaction, but not just because we want to completely eliminate that particular behavior. We might not be able to do that. That is just part of that individual and their disability. And so the antecedent, as you see, it's a little bit different than the other functions that we covered. This is really when the individual is not engaged in something specific, it's their free time. And an appropriate behavior that fits this function, the automatic self-stimulatory function, might be playing with a sensory box. It could even be playing an instrument, right? And a problematic behavior looks like spitting on the table and spreading saliva to seek that sensory stimulation. So let's look at some example also for this function. We have the first example, antecedent, having bug bites. The behavior is scratching and scratching his leg. The consequence is a temporary relief of the itching. Another example, it's recess, that's our antecedent. The behavior is that there is excessive rocking and noise making by this individual. And the consequence is that the teacher directs the child to another table due to the noise. And see here, we see that the excessive rocking and noise making is as a coping skill because of overstimulation from that environment. And then another example, our antecedent, it's a free time. The behavior is playing guitar and singing, and the consequence is just feeling good. So we're gonna practice with one example, identify the function, and then our breaking it down into our ABC and then the function. Lisa doesn't play with toys, and when she's done with her schedule, she goes into her room and likes to spin pencils for hours until it's time for dinner. Typically, she's left to do this every day. And so our antecedent here is that Lisa is in her room by herself during her free time. The observable action is that Lisa spins pencils in her room for hours. And the consequence is that she's left to do this until dinner time. And so that fits the function of automatic or self-stimulatory. And again, we're gonna look at what can we do to address this behavior by modifying what happens before the behavior and after the behavior. So we're looking at antecedent strategies. Again, building rapport, ensuring that we have that connection with the individual. We want to structure the environment with activities that are stimulating for this individual. And at the beginning, they might just look very similar to spinning, right? Over time, we might be able to teach alternative one, but they might have, they really need to mimic the sensation that she's trying to achieve with the pencils. We want to let her know that these activities are available, that this is what we're going to do with a visual schedule, and offer choices. And she might be able to let us know what preference of the sensory activities she likes and enjoys. We want to also increase activities that involve exercise and overall sensory motor movement in general, in an individual routine, especially if they are exhibiting a lot of sensory stimulating behaviors. We want to arrange the environment so that perhaps she does not have access to boxes of pencils in this room, but maybe that is more in a controlled location, and there are less pencils and more availability for the other more appropriate activities that, again, fit the same sensation for her. We might teach her using errorless learning, really modeling, maybe hand over hand. And then we want to teach her then how to request these activities that are stimulating and reinforce it by giving her access to it, and also in social praise. And should the behavior not be preventable, then we want to implement an automatic extinction procedure, so stop the activity and redirect to a more appropriate activity that produce the same effect as the problem behavior. We just really need to be careful as we interrupt this process that the individual might become upset. And so we'll talk about later on in a little bit about the extinction burst procedures. And so I do have another little video for you as an activity, and I'm going to make some changes with the screen real quick.
The perfect English muffin topping is more.
Duh.
I'm gonna stop it there. Same example as before, and I wanted to see if anybody can think about possible function for this scenario. And so, if you have your booklet, you should see this chart on page 27, where again we're going to break it down into an antecedent behavior consequence. We already saw this example before. And anybody wants to take a guess as to what this behavior function is.
I just love that little guy. Total attention.
Total attention, absolutely.
Total
Absolutely.
attention, right?
Yes. All right, and so in summary, what we have reviewed is that behaviors have four main functions: the escape function, the attention, access, and self-stimulatory. Why is it important to know the function of behavior? Because when we're considering addressing maladaptive behavior to modify, there are specific interventions that are based on the function that we can implement to prevent behavior, so antecedent strategies, and after the behavior has occurred, consequent strategies. And again, we want to look at not only modifying the problematic behavior, but paying attention to what are those, and we call those replacement behaviors, so those functional skills that we need to teach the individual that meet the same function so that they will not engage in the maladaptive behavior in the future. All right, we're going to dive into our next section called extinction. And so several considerations when modifying problem behavior. And so again, let's remind ourselves why we want to, again, quote, modify problem behaviors. Well, problem behaviors are a type of communication and expression, but if it affects learning and social relationship or safety, then we need to teach appropriate lagging skills and address these maladaptive behaviors. We want to make sure that we're not changing the individual characteristic part of a diagnosis, or that's not the goal of modifying the maladaptive behavior. And we want to reduce the possible danger and threats, the risk factor that impact learning, and we want to improve the individual and family quality of life. And again, really focusing on teaching the core skills that are missing. And so we talked a little bit about the how earlier, right? When we addressed each of the function. And it's really by looking at what happens before the behavior, the antecedent, what happens after the behavior, the consequence, and then by looking at the function of the behavior and building in antecedent and consequence strategies to work together. And so each function, again, tells us why the behavior occurs. Applied behavior analysis gives us specific effective intervention based on the function, and we're able to then modify the problem behavior and teach and increase those lagging skills. I referenced to this principle of extinction, right? And this is a consequence strategy, and in a nutshell means to change what happens after the behavior, right? So really modifying and no longer reinforcing that behavior. And so, for example, if I want to decrease crying for that chocolate milk example that we talked about, I should not give the chocolate milk when the child is crying, right? I should give the chocolate milk when the child is able to tell me, I want chocolate milk, and maybe wearing his bib like mom was trying to do it in that video that we saw. Each function has a specific extinction procedure. We touched base a little bit when describing those examples in the function, but I do want to take a time to review it a little bit. So what happens when we start changing or modifying, no longer reinforcing that behavior that was working before for the individual, right? What do you mean? Before, when I was screaming, mom would immediately hang up the phone and pay attention to me, and at least, you know, even if she was scolding me, she would at least, you know, no longer be on the phone. Well, now she keeps going with her conversation. So what happens? So the behavior increases and gets worse, and that can look in an increase in intensity. So the screaming gets louder, the property destruction gets more severe, but also maybe new behaviors might happen. Maybe, you know, the child would never spit, but now that mom is not paying attention, now as she's on the phone call, I'm gonna try some spitting and see if that works, right? So it's until the individual reaches kind of that point where, oh, okay, that engaging in this behavior no longer, I no longer obtain what I used to, which is mom's attention, then eventually it'll start decrease. And so because of how severe the behaviors can get, we need to make sure that we use these extinction procedures only in combination with the antecedent interventions that we reviewed earlier, to make sure that we're doing everything that we can to prevent the behavior from happening, and also ensuring that we're teaching the appropriate skill. So, hey, screaming and spitting to mom while she's on the phone is no longer working. Mom is not going to pay attention to you, but as soon as you tap her on the shoulder or you wait appropriately, then mom can spend X and YZ time with you, right? Again, a lot of caution we need to implement and be aware of when severe behaviors are already happening and we haven't even touched the extinction procedure, and extinction procedure might not be appropriate for aggressive and self-injurious behaviors. And so definitely before implementing these strategies, we need to consult with a professional to make sure that we have the right support system and antecedent strategies to do that. So let me guide you what extinction looks like. Like I said, we already reviewed it a little bit, but just to make sure that we are clear. And so for the escape function, We want to follow through and reduce the task. So in the example of mother saying brush teeth, behavior being the child throwing an item and running into his room, the consequence of the example was the child does not brush his teeth. Well, the extinction procedure, based on the fact that the function is escape, we want to follow through with brushing teeth and reducing the task as needed. And we mentioned it before, like even maybe touching the lips with mom's help. For the attention function, if mom is on the phone and the child screams louder and louder, instead of mom hanging up the phone and reprimanding the child, we want to have mom keep talking on the phone, avoiding eye contact or talking to the child. So not providing that attention. That would be the extinction procedure, excuse me, for the attention function. For the access function, when we have an example of mom saying no more iPad, right? The child screaming and kicking mother, and the child continuing to use iPad, what we want to do instead is remove access to that iPad physically, if we're able, without causing any power struggle, or maybe using specific app that limit the activity or internet access. And so extinction procedure for an access function would be to remove access to the item. So don't provide access to the item. And for the self-stimulatory automatic function, when a child is engaged in his free time and engages in spinning pencil, instead of having the child continuing to spin the pencil right until it was time for dinner, we want to block that and redirect to more appropriate activity. So let's practice and talk about, really, because the video is going to be the same exact video that we saw of that poor little guy just engaging in screaming. We talked about that the function of his behavior was attention. And so in this example, what do you think it should be the extinction procedure based on the function? And so we can go back to our notes, or even just the slide here. So we go back to attention, and then what do we have here? Well, we need to remove attention and plan ignore. So what the parents were actually doing, and even the dog, it was an extinction procedure for the function of attention, right?
Okay, I was just wanted to. I just wanted to make sure I wasn't mucking this up, because you know how my head worked.
No, this is a lot of information, and sometimes you know, just a lot of different concepts, and so it's a lot of info.
You know, one of the takeaways, you know, again, that I want to take away is you have to stay consistent, and you have to also stay not just consistent, but also have that patience, because if you give in, then
right,
it's going to be twice as hard to gain back any control.
Absolutely. I think you make such a good point that if you're starting to implement for a couple of days an extinction procedure, let's say like this example of the video, right, where mom was ignoring, right? But then let's say that maybe the next day you're by yourself, dad is not there, you're tired, and you're like, okay, what do you want? And you provide attention. That is going to be really, really difficult next time to really follow through, because now the extinction burst, right, that temporary increase in behavior before it gets better is going to be even higher, right? And I don't want to get too technical here, but one of the worst thing that we can do when we are trying to decrease maladaptive behavior is to provide intermittent reinforcement. So meaning that sometimes I will implement the correct strategy, and sometimes I will just continue reinforcing the inappropriate behavior. And that's something, if you want just an example of a kind of more like a daily living type of example that it helped me when I was, studying my coursework and all this material for my, exam and certification, is really relating it to how addictive are, for example, slot machines for some people, right? Why they're so addictive is because they give us reinforcement of a win on an intermittent schedule. So you can use this as increasing appropriate behaviors and intermittently reinforce them. And that's the best way to kind of maintain them at a higher level. But you could do, kind of the opposite and kind of like a more damaging effect if you are intermittently, and so in other words, not being consistent, if you're doing it with maladaptive behaviors. All right, very good. Let's move on to just our summary regarding extinction. So we talked about it being a process by which a behavior is no longer reinforced. We talked about safety that needs to be considered before implementing extinction procedure. Forget about reinforcing maladaptive behavior if there is an issue about safety. Don't worry about following through the right strategy, just safety first. We talked about that extinction is a delicate procedure because it leads to extinction bursts, which is that temporary increase in the intensity and frequency of the maladaptive behavior before it gets better. And we talked about how being consistent, it's really the key to getting on the other side of decrease of this maladaptive behavior. Now, sometimes these are questions that I'm asked by parents where, will this problem behavior going to be extinguished forever? And is this behavior gonna come back eventually? Well, it might come back eventually, and that's called spontaneous recovery because there is a history of this behavior. But as long as we are teaching replacement behavior, so appropriate skill and really understanding what are the lagging skills and they are being reinforced, there shouldn't be any reason why the maladaptive behaviors would come back. However, we do see that changes of environments, changes of staff, especially with individual with disability, that really require a rigorous, detailed plan in order to keep this behavior, under control, especially if they're using visual stimuli, certain schedules, certain equipment or augmentative technology. If we are all of a sudden missing one piece of that puzzle, then the behavior might come back because those support system now become part of how that individual functions and is able to function. And so we have arrived really kind of at our conclusion of our training. And before we open it up for question, I wanted to quickly summarize what we kind of covered today. We touch base first on self-care and self-love as kind of the fundamental step, even before going into our work with families as advocates or coordinators, administrators, teachers, educators, parents, and really honoring that connection and relationship building process with this individual. And even though some of the learners that we work with don't have the same communication skills or ability to reciprocate, at least in the same way, our interactions, like maybe you and I might do, they do have individual ways of expressing it. And so learning happens only when we have this fun kind of base of trust and safety and compassion and really being at that baseline level with them. We talked about why we want to modify behaviors and when to do it. We talked about how we can modify behavior. We reviewed and learned how to break down behaviors into the ABC, antecedent behavior consequence. We talked about and repeated a lot of times about the assessing and teaching lagging skills as a really important piece of this puzzle of decreasing maladaptive behaviors. We talked about reinforcement and punishment for increasing and decreasing behaviors. Talked about functions of behaviors and the extinction procedures. And one last thought is that, behavior intervention plans for decreasing maladaptive behaviors really take time. They really take practice and consistency. And if you're working right with the team, and it can be, the team of mom and dad, the team at school, right? We need to make sure that the strategies in this great plan that we have are then being delivered in the correct way, right? Because we can have a great plan, but then if there's no monitoring of the strategies, then there's really no follow through and implementation of that plan. And so with that consistency and practice, then the individuals and kids can really learn those skill sets that are really at the basis of this maladaptive behavior expression. So this really concludes our training.
Oh, sorry about that. I was looking for my video. I'm like, So Juanita Jones says, I enjoyed the self-care, giving parents time to deal with their own emotions before dealing with the behavior of children. Absolutely. Right? Because if you don't, if we don't remind them, if we don't remind each other, especially during really stressful times, the behavior will then in children will get worse.
Right.
On one level or another, right?
Right, absolutely. And sometimes working with families, I they might have all these goals for Johnny, but then just looking at mom, I could sense that she's so overwhelmed, and how is she gonna follow through with 4 pages behavioral plan, right, to address Johnny's behavior when she's so overwhelmed. And so I think it's okay, and I know as professionals, sometimes we just want to go in, do the job. We know that, we have the research of the strategies, we know they're effective, but if the family is not ready, then we cannot really have, produce that change that we want. And so we kind of gotta, one step at a time, meet the families where they're at and kind of take an analysis of what's their family dynamic, because it's so unique.
Right. No, absolutely. And I think most of us in here, I'm just looking at names right now, are caregivers, or they work for social services in one level or another.
Yeah.
So what I was, saying earlier is it's just so important that you keep on bringing that mindful Mondays, or the mindfulness, to you, which, by the way, guys, last thing before we sum it up here, right, is if you go to YouTube, you type in ABC for IEP, there will be a Mindful Monday little series that you can watch, and it does all the exercise and goes really into, into that meditative state, and it also has nice relaxing background music.
That's right.
Yeah, that's right. So, please, I've done this now for a good solid month, just using that, and my anxiety from here to here is just always consistent. So something to consider when you bring in the holiday cheer, especially now.
Well, thank you so much, everyone, for attending this training. I hope it was helpful, and there are some nuggets of knowledge that you can bring back to yourself or the families that you're working with or other professionals. I wanted to leave you with a quote that kind of resonated with me in the past month, and it states that beneath every behavior there is a feeling, and beneath each feeling there is a need. And when we meet that need rather than focus on the behavior, we begin to deal with the cause and not the symptoms. So just wanted to leave you with that. Thank you so much again for your time.